Hey guys, Tina here. For this week, we were supposed to explain our research methodology and data collection approaches. As a reminder, my hypotheses are the treatment of obstructive sleep apnea among patients with hypertension negatively affect or reduce cardiovascular events, and the treatment of obstructive sleep apnea among patients with hypertension positively affects or increases a patient's quality of life. And then the treatment of obstructive sleep apnea among patients with hypertension decreases the burden of national expense. For my research methodology, I will be using primary and secondary research. My primary research is through retrospective chart review, and my secondary resources will include scientific papers, articles, and existing statistics. I will use subjective questionnaires that provide a score about personal sleep and its effect on life. I feel like the response rate will be 100% because they are completed in office at follow-up visits, always. These questionnaires are the ESS, or the Epworth Sleepiness Scale, and then the Stop Bang questionnaire. And then also I would use records from our sleep lab from a hospital in Mississippi. Data collection will include patients that are diagnosed with obstructive sleep apnea and hypertension, and they must meet the definition of compliance determined by CMS, or the Centers for Medicare and Medicaid, which is that CPAP usage has occurred and is recorded for at least 4 hours a night, 70% of the time. And then other criteria will be that CPAP usage must exceed 3 months. So I would not count anything up to 3 months, but beyond 3 months. This allows a buffer of time for the patient to acclimate to the device and the pressure, and also the body time to recuperate, so that we can see if those blood pressures have changed any. I would also collect the number of antihypertensive medications each patient was on. And then our participants would be ages 18 to 90. I would also record BMIs for each of those. I would include those that have signified that they are their gender, male or female. And then races categorized as Caucasian, Black, Spanish, and other. And then other comorbidities of the participants except heart failure. Blood pressure readings from all participants before the CPAP usage to determine the effect of usage on cardiac function, before and after CPAP usage. Number of ER and physician visits related to cardiac symptoms before and after CPAP usage to determine its effect on cardiac events. And then, of course, I would use the questionnaires mentioned before, the Epworth Sleepiness Scale and the Stop Bang score. The results of these questionnaires will help determine if there's been improvement in quality of life. Research already says that improved sleep and decreased sleep deprivation includes quality of life, and we can reference these questionnaires as that measurement. We'll have questionnaires before CPAP usage, those questionnaires, and then after, so that we can look for an improvement. And then exclusions would include, of course, any participant or patients less than 18, over 90, those that were not gender specific, those with heart failure, and those that, of course, are non-compliant to CPAP use by CMS's definition of compliance, as mentioned before. So less than 3 hours of sleep and less than 70% of the time. These are my factors I'm going to go with or work with, and if you have any ideas, just let me know. Thanks.